Good afternoon, good morning, good evening, wherever you are around the globe. Thank you so much for joining us today. This is the Malawi Diaspora Network, MDN PPE Healthcare Workers Campaign Finale. Can you believe it? We are here today to do the finale, and thank you so much again for your support. Thank you so much for joining us. My name is Christina, and I am hosting you all the way from Spokane, Washington. And I'm not the only one in the show. I also have friends who will be joining me, and I have Ken Malomboza, and I also have my other friend Eddie Namimona, and they will be joining us, introducing themselves as well as the hosts of this show. Hello, Ken. How are you doing today?
I'm doing good. How are you? How are you?
I am doing very, very well and very excited to do this campaign finale. And thank you so much. Hello, Eddie. How are you?
Hi. Nice seeing you guys again. I'm doing well. How are you?
I am doing wonderful. And thank you so much again for joining and for hosting all our viewers out there everywhere in the world. So here's the rundown, everybody. We are going to do a quick introduction of who we are as the network and also a little bit about ourselves. Then from there, we actually have a few things in store for you. Thank you so much for being with us on this past, I've said 2 months. We've had this journey where we've had this Malawi Diaspora Network conversations. We've had a few shows to fundraise for this PPE, and we are so overwhelmed by your support. So in this show today as well, we have actually the partner organizations will be working within Malawi. So they'll be talking to us. They're coming in later. And we also have DJ Ken out there who has a set. And so get your shoes on, get your dancing shoes on, because we are not here to play. We are here to do this finale and have a wonderful time. Ken, up to you.
All right. Hey, good afternoon, everybody. Good morning, depending where you are in the world. I'm so excited to be here. This is a very noble cause that we're doing this evening, and we'd like to thank everybody else that's tuned in. We'd like to thank everybody else that has donated. We'd also like to thank those that have not donated, but they want to donate this afternoon. We're going to have a great time. I'm with Malawi Diaspora Network, but I'm also with Malawi Community USA, and I'm Malawian all the way. And to my friends that are from the United States, welcome to this finale. I don't want to call it a show, but you call it whatever you want to call it. Put your dancing shoes on, and Eddie, up to you.
Hi, everybody. Welcome once again. This has been a labor of love. When we started this, some people actually laughed at us thinking we are not doing anything important, since at that time we had no case of COVID in Malawi. But as we had said at the beginning of this campaign, we did not want to be in a reactionary state. We wanted to be ahead of the game. We wanted to take lessons from all the other countries and what it takes to be able to help others in this condition. And as of today, we have moved in these few weeks from 0 cases to now over 3,000 cases. And not only that, we have lost close to 100 people. I just got an update from Dr. Maziko Matemba, who was here a few weeks ago on this show, making a case of the need for us to organize ourselves and to help fund PPE for health workers in Malawi. And these are the numbers that are ongoing, and we know that they're probably even more than that. These are the confirmed deaths that we have, but who else do we know that didn't make it to the hospital that has succumbed to this plague? So we are asking you once again to open your hearts and your wallets and help us help those that are on the front line. Thank you very much.
Thank you so much, Eddie. And a little bit about the network itself. And I also want to say, you see the 3 of us representing everybody, but there's a whole team that made this happen. So I'll talk a little bit about the network, and we'll get started into why you're actually really here. So I would like to just give a shout out to say this is a network of different organizations that are run by Malawians across the United States. So in this one right now, we have the Malawi Washington Foundation, and they are a 501c3 as well. And we have Malawi Association in Washington, MAWA, and we have the Malawi community in the USA. We have Malawi Seattle Association, our region out here, woohoo! And Malawians in Texas organization, New England Malawi Association, and also the Embassy of the Republic of Malawi. And again, this was the team effort. I will announce some of the names, and my friends Ken and probably Eddie will also kind of give a shout out to all the people who've been really behind this machine. And again, it was a labor of love, as Eddie said. And to begin with, His Excellency Edward Sauerengera, our ambassador here in the United States. Thank you so much for being part of this amazing work. Alinafe Chiponde and Sitinga Kachipande, Dr. Sitinga Kachipande, myself and Changa Kamwambe and Marvin Kaulembe, Helen Zimba in Texas. Eddie, take it away.
All right. Some of the people you've heard, and we are all over the US. So this wasn't concentrated in one area. We have people here from DC, some in Washington, some in Boston. We have a production team behind all of this, including as the committee that came together to do this. All in all, we have over 20 people that are behind the scenes. Many of the faces you will never see, but they have been passionate in and out, making sure that not only do we get the program ready, but we also get to vet every partner we get to partner with in Malawi. Because our biggest issue in these campaigns is always finding a credible partner to be able to channel your funding to, and to make sure that every penny is going to work for what we said we want to do it with. So we have such names as Elisa Muntali. She's actually behind the scenes here in the production room. Felix Ndaire, Hanok Ngoma. You've heard about Marvin, Patricia Kankondo, who is actually the president for the Malawi Association in Washington, the MAWA. Robert Tim Seteka. We have Violet Skeva, and we also have Jordan Price, who is I'm trying to remember what his title is, but he's the honorary consul to Malawi, and he lives in Texas. He's been part of this group from the beginning, and making sure that we stay on task. So I'm looking forward to today's program.
And a few other names as well, Wezi Longwe as well, and Ken Malomboza, thank you. And we have Mwiza Muntali, thank you so much for being part of all this. And also Agnes Nkata Blackwood from Texas, and our own Dr. Linda Semu. And so talking about Dr. Linda Semu, actually, we are going to transition into her talking about why we've done this campaign, really. Why can all these brains and kind of the talents behind the campaign come together to do all this. So our Dr. Linda Semu, the chairperson of this campaign. Welcome, Madam. How are you today?
I'm doing well, thank you. Thank you very much. Thank you for having me. And of course, thank you to all the people who have supported the campaign. All right. All the people who have supported the campaign. I'm just going to do a brief run through in terms of why the campaign and where we are. And to just remind everybody, on May 8th, 2020, this year, Malawians based in the United States of America announced the launch of a fundraising campaign to support Malawi's coronavirus COVID-19 response efforts. And the campaign was launched to raise funds for the procurement of life-saving personal protective equipment, PPE, like masks, gloves, and gowns for frontline health care workers in Malawi. Of course, when we launched the campaign, we fully acknowledged that Malawian healthcare workers were already fighting the pandemic. And throughout the pandemic, Malawian healthcare workers have shown resilience and innovation, and they have not, and we want to repeat this, they have not been idly waiting for assistance from abroad. They have actually been on the front line working, even from the initial stages of the pandemic. And of course, we also have to acknowledge the local communities. They have mobilized, they have improvised to make masks and hand sanitizers, while also setting up hand washing stations in crucial locations in Malawi, urban areas, as well as rural areas. However, it became clear that financial assistance is needed to help the healthcare workers get ahead of the pandemic. And it became clear that the pandemic was likely to morph and overwhelm an already fragile healthcare system and economy. So, and just to remind everybody, when the fundraising campaign started in May, there were less than 20 confirmed cases of coronavirus, positive coronavirus cases. Fast forward to July, the number has climbed to 3,453. So just about 3,500 confirmed cases and just under 100 deaths, most of which have occurred within the past 2 weeks in July. So the numbers are rising, and that's why this is a needed intervention that we had to do to contribute to the fight against this challenge. And the Malawians in the diaspora who have potential to play strategic roles in Malawi are there. They're willing, and of course, because of globalization and mobility and ease of mobility, communication, technology, communication. People are supplanted. They move out of Malawi, but they are never uprooted from Malawi. Their identity and practice is still Malawians at heart. And so whatever happens to Malawi, although people are away from Malawi, they're still connected and they're intimately involved and affected as well. So that's why we have this fundraising campaign, and it's being coordinated by the Malawi Diaspora Network. As our host Christina mentioned, the Malawi Diaspora is a network of various organizations, and it's a coalition really. And our main interest is to address issues of concern to Malawians at home and throughout the world. And once again, I want to acknowledge the support from the Embassy of the Republic of Malawi to the United States, and the role that His Excellency Ambassador Edward Sawirengera, as well as the staff at the embassy, have contributed and played within this effort. So the question is, what was our intent? And in terms of intent, for the fundraising campaign, our goal was actually to raise $15,000. And so we called on the campaign, and we relied on a vast network of Malawians living in the US or abroad in other countries, as well as friends of Malawi to contribute to the campaign. And the organizing committee for this campaign set out to keep sustained engagement around the campaign so as to generate donations. So we used a multi-pronged strategy. It comprised virtual discussions, an 8-hour concert, and online fundraising using GoFundMe. A lot of you saw that on Facebook, but we also used Zelle, we also used Cash App, and we've had a number of people continue to support us. Some people have sent personal checks. Any form of support is welcome. So, ladies and gentlemen, all right, this is the time we have all been waiting for. We are pleased and we are humbled and pleased to announce that we have surpassed the fundraising goal. Remember, the fundraising goal was $15,000. And as of today, drum roll please, as of today, we have raised just under $18,000. Just under $18,000. And it's all because of you. Thank you, thank you, thank you Thank you to all the contributors, the donors, the participants, and some people have donated in kind just to facilitating to make sure that this campaign was going seamlessly. Participants, the artists, the professionals, experts in various fields, all kinds of contributions. So we just want to say Zikomo, thank you, Zikomo, Malawi warrior. I mean, this is really Ubuntu. This is really community. This is what it means to be a part of a community. And it doesn't matter where you are. You don't have to be physically in Malawi, but you have shown that Malawi is at the heart of who we are. And for that, we are very, very thankful. And we're excited actually in terms of what else we are going to be able to achieve moving forward. Thank you very much, Christina, and thank you everybody else. I will be back. I'll be back later, but for now, I really, I mean, I'm excited. When I looked at the numbers, I was like, what? And by the way, we are still open. The campaign is still open. We're going to officially close the campaign on the end of the month, July 31st. So if you still have a little bit, actually yesterday I got a check in the mail, a $20 check in the mail. So it doesn't matter the amount, whatever you can contribute, please feel free to contribute. No amount is too big or too large or too small. Every dollar counts. So thank you very much again. Zikomo. Thank you.
Thank you so much, our chairperson, Dr. Semu. And as she said, we've raised a little over $18,000, and we have not done this without. And again, we are still collecting donations because there's so much need. And again, for you, where to go to donate. So for the GoFundMe, if you have the MDN PPE for healthcare workers in Malawi. So that's the GoFundMe. We have so many different platforms. PPE4Malawi at gmail.com, PPE4Malawi@gmail.com. And we also have Cash App because we know so many people like to donate in so many different ways. So the Cash App is the $ MDN Malawi PPE, MDN Malawi PPE. And thank you so much. So for the next part, we'll be introducing our actually implementing partners in Malawi. I will talk a little bit about themselves, but before we do that, why don't you come in, Ed, and talk about kind of like the selection process, like what we had to go through, because we know that this is your money, you've donated this, so we want to make sure that we are being kept accountable and the money is going where it's supposed to be. So I'd like my friend Eddie to talk a little bit about our selection process and what we had to go through that and kind of the role this organization is going to play, and also the procurement process of the PPE products.
All right, thank you, Christina. The way we handled this was we had a committee, and it was composed of myself, Ken Malomboza, Helen Zimba, and also we ended up getting Mwiza Mutale on board. And what we wanted, the criteria was, one, an organization that's existing, not just somebody out there who is not doing anything for the community. We wanted an organization that was already on the ground, had the infrastructure to be able to go out there and get the products for us, identify suppliers, identify places that are in need, and which are many. And so it took weeks. It seems like it's a simple thing, but you have to be able to get the information. As they always say, trust but verify. So even when we would get the information to say, maybe try this group, we always followed up with other people to sort of vet them to find out what are they doing and what is their reputation on the ground and what communities do they serve. And so week after week, we would come up with a list of, here's what we've gotten. Do they align with what we have put together as a criteria for our partners? And so at the end of the day, we were looking for, again, a credible partner that had an infrastructure. And we just happened to have an organization, LifeCare Malawi, that has incredibly been doing a lot of work on the ground. It has established itself with the community. It runs a mobile clinic. It does a lot of things for free. It also gets supplies, medical supplies from outside beyond just this per se. They have a clinic, they have a health center, and they have a non-profit that's doing nutrition, and their outreach is just incredible. And so at first we thought, oh, let's go out and help hospitals. But the organization being on the ground, they said, you know, yes, it's okay to go do the hospitals, but do you know that the first places people will go when this happens is actually going to be the local health centers? And everybody forgets about these local health centers, the local clinics. And so we listened to what we were told, and we said, you know what, maybe we may actually make a greater impact in the small health centers than going out, let's say, to Chikwawa Hospital, even though we know Chikwawa Hospital or Mwanza or Karonga needs the help. But the first line of defense from people in the village, when this hits, it's going to be the health centers. And so that was an incredible information to have at hand. So this is a kind of process that we went through. And then at the same time, trying to compare prices. We want to support the businesses. We don't want to buy anything from here and send it out there. We want to be able to source everything on the ground. Who do we choose? And we went to also look out for suppliers that could be vetted, suppliers that actually do this line of work, providing quality equipment to hospitals. So it wasn't just, oh, Eddie goes to South Africa to get supplies. No, it was, what do you actually do? You actually have supplies that the professionals in Malawi can vet. And we went through each product. We had a list. We went through each product. We went out to different suppliers, and then chose those that could be able to not give us affordable prices, but also not compromising on quality. And good enough that all the organizations that we approached to do even the supplies, they also have a mission in mind to say, you know what, this is important, and we know you're doing it for a good cause. They didn't want to hike up the prices like you would do in retail. So that worked to our advantage. But as we go on through this program, you're going to hear more and more of the process, or at least of our partners, and give you the confidence that the money we are raising, we are continuing to raise, is going to do what it's supposed to do. And we expect also for them to report back to us, and we report back to you. So one of the criteria was, do they have a capability to manage a finance team that actually is able to do this and to do a reporting on their end and submit to us, and we submit to you. And sure enough, we have all of that. So stay tuned, open your dollars, your wallets, and just remember, this is for a good cause. PPE for Malawi. All right, thank you.
Thank you so much, Eddie. And Ken, do you have anything else to say before I jump in?
Once again, we are so grateful for our partners. Everybody else is doing this pro bono, just so you know. Every dollar that has been contributed, just going straight to the cause. We are very open. Eddie is our main accountant with Felix Lindeile, and we are going to give you guys a very detailed report on where the money has gone and everything that we've spent on the money. But just to add up on that, I mean, I'd like to thank the team. Everybody is busy, especially here in the United States. You know, we were going through, I mean, Malawi was not serious at the beginning, like Dr. Semu said. Everybody else had work, family, and other things to do, but everybody took their time to put this thing together. So I'm very grateful of the team. I can't mention everybody by name, but I just want to say thank you. And to our donors, I just want you guys to know that we are very grateful. As Dr. Semu said, we've surpassed our goal of 15,000. I think with the surgency of COVID in Malawi, I think we could do better, and we're going to make a mark. And I think this is for a great cause. But everything else has been mentioned. Without wasting time, I'll back to you, Christina.
Thank you, Kenny. And so again, yeah, there's so much need right now, and I believe in us. I believe that we can even get to $20,000. Who is out there with me to get to $20,000? I know we can do it, and we'll do it today. And so, before I transition to the next part, I also just want to say it is organizations like LifeCare Malawi that actually make things happen on the ground in terms of connecting the gaps where our healthcare system can reach. And in the past, we talked about in Malawi, it's like one doctor to every 28,000 people. That is a lot of people. And so organizations like LifeCare Malawi kind of fill in all those gaps. And we've always said, Mudu Modzi Susenzadenga. Mudu Modzi Susenzadenga, we can't do it by ourselves. So organizations like LifeCare Malawi are very important. And so, without wasting so much time, I would think you're so excited to also meet this organization. So Dr. Semu is actually going to take us through a question and answer session with some of the representatives from LifeCare Malawi. And thank you so much for staying up late to be part of this program. And we are so excited to continue working with you. Welcome.
Thank you, thank you, thank you. I just want to do a quick introduction before we bring our colleagues so you can meet them. And our implementing partner in Malawi, as has already been mentioned, is LifeCare Malawi Foundation. You can also find them even online. You can search for them, you will find them. Very comprehensive website, very comprehensive accounting system, everything is in place. It's a registered Malawi-based nonprofit organization. They operate in 5 districts in Malawi, in Malaka, Blantyre, Chiradzulu, Morante, and Tioro. But they have also a history of collaborating with other organizations. And this foundation, actually, they offer various services. And mostly their services are to support vulnerable populations in Malawi. Including in the areas of agriculture, education, health, and community development support. And their focus is on eradicating poverty and ensuring food security and bridging the access to education and public health gaps that exist in Malawi. And they do most of this work through community-based programs, as well as through empowering vulnerable groups within communities, more especially children, youth, girls, women, and the elderly. So this afternoon and of course nighttime in Malawi, we have 3 representatives from the foundation. And the first I want to introduce is Dr. Pax Matipwiri, President and Chairman of the board. He's a medical doctor with training from universities in Kenya and Finland. And he has a PhD from Oregon State University, where he studied global public health. And he has experience working with vulnerable communities in Malawi, having worked as Director of Programs and Community Health Services at Malamulo Hospital until 2019, when he transitioned to working full-time at LifeCare Malawi Foundation. And this is a foundation he established in 2015. And the fact that Dr. Matipwiri has impeccable qualifications that makes him and the LifeCare Foundation the most suitable implementing partner is unquestionable. They went through a whole vetting process, as the hosts have already explained. But what I want to do for just a minute is to tell you about the man. I had heard of Pax over the years, and it was only in March of 2019 that I was introduced to him. The foundation had a student in Malawi whose sponsor for her studies passed away just when the student was about to enter her final semester in nursing school. So Pax was frantically looking for sponsorship for this young woman, despite the fact that at that time he was also pursuing his graduate studies at Oregon State University. So Pax and I got connected through my work at the Malawi Washington Foundation, where we support girls' education. So we got connected and we talked at length. At the end of a 2-hour conversation that was meant to be a 10-minute phone call, I knew that the work that he is doing is a calling. And his commitment to uplifting the vulnerable in Malawi is unwavering. And I had a chance last summer to visit life offices of the LifeCare Malawi Foundation, and I was able to observe some of the work that they do. And Patrick and his team are as good as they can. Let me therefore briefly introduce you to two of his colleagues who are also going to be with us this afternoon. And first, I would like to also introduce JoAnn Deneen. She's an international volunteer. She is the chaplain of LifeCare Malawi and the education coordinator. She holds a Bachelor of Arts in Journalism and a Master's of Science in Inclusive Education. Since she arrived in Malawi from the United States in July 2018, she has spent 2 years in Palula, Balaka district, and she's currently serving in Luchenza, Toro district. Along with assisting in reading and literacy at the newly founded Life Care School in Luchenza, she also uses her home as a base to serve vulnerable children, youth and adults with a lending library, newspapers, board games, toys, Bible study, and lengthy conversations about America. And of course, the stir fry. Who can forget about the stir fry? All right, welcome, JoAnn. I'm happy to have you here. And last but definitely not least, I would like to introduce you to Dr. Gift Chinomba. He is a physician. He's serving for LifeCare Malawi Foundation as a medical doctor, and he has extensive clinical knowledge and experience from the Malawi government, having served as a district health officer. He holds an MBBS from the University of Malawi College of Medicine, and he has 8 years working experience in medicine and management levels. So we are welcome, Dr. Chinomba, and welcome all of you to this brief Q&A, because we would like for people, I would like you to introduce yourselves, and so that people, the donors, would like to know you, would like to know more about your work. So just to get started, to all of you, feel free to chime in whenever you're able to. Just to get started, can you tell us a little bit about how do you reach the vulnerable communities? Because it's one thing to talk about working with vulnerable communities, but what do you mean by vulnerable communities, and how do you reach out to them?
Okay.
Yeah.
One thing that I thought of is, I said that I served in Palula for 2 years. We just happened to be there a couple of days ago. And while I was there, I did all the things that you already said about the house thing. But I noticed nobody was wearing masks, very little hand washing, very little social distancing. And so that is one of our goals, is to help villages not just have those, but know how to use them. Because people sometimes in the villages don't know how vulnerable they are right now. They may know they're vulnerable about their education or their income, but not everybody takes COVID-19 seriously.
Could you please speak louder, the volume, because of the distance? We want to be able to hear.
Okay. Well, I'll just say
That's
that.
better.
Yeah. As I said, I served in Palula for 2 years. I did all those things that you mentioned. But one thing that we noticed when we were there a couple of days ago is that there's not very many masks, hardly any. People aren't washing their hands. People aren't social distancing. And so that particular vulnerability, just with COVID-19, is huge. I've noticed that where I'm going. And Pax and I have discussed that maybe people don't even really believe that there is a danger. So that is something that's on our mind. But for me, I'm always looking at education. I'm always looking at young girls. How can you make this world have a future? Because that's just so critical for these people.
All right. Thank you very much indeed. Reaching out and educating is very important. Public awareness is very important. Dr. Chinomba, before I go to Dr. Matipwiri, just I know you are a medical doctor, but you're also in management. So tell us, in terms of of course, coronavirus is a medical condition, but how does it interface with people's social conditions, poverty, education, and so on and so forth, in terms of what you are seeing on the ground?
All right. Thank you so much.
We can't hear you. We can't hear you. Dr. Chinomba. Dr. Chinomba, we can't hear you.
Okay, so we're trying to switch our mics because we are close to each other.
Okay.
Can you hear me there?
Yeah, we can hear you now.
All right.
Yes, go ahead.
So, yeah, you can hear me properly.
Yes.
Okay, so yeah, indeed, on the ground, we are seeing a lot of social issues. I think some of which we never anticipated that they've reached that extent. We've seen that, I think, first and foremost, we've seen a lot of, in terms of social, a lot of companies, a lot of institutions scaling down, other institutions, maybe people being retrenched, and that has translated poorly in terms of their social well-being. We're running a hospital here. One of the things that we've seen is that in this time of Corona, people are hardly able to seek for medical services. So due to a number of reasons, most of them, with this, they haven't been socially stable. Hello?
Yes, we can hear you. Yeah.
Yeah. So what we've already seen is that already it's hard for people to as of now to seek for healthy services than the way they used to do, because socially people are not stable. People are trying to look for other ways of trying to survive, because most of the routines that used to make their survival aren't there as the way they used to be. We've faced a lot of, as I say, retrenchments. People have moved out of their jobs, and that has translated poor on the ground. I think that's what we are seeing more.
Yes, that's a very serious problem. And to both you and Dr. Matipwiri, I just read something last night about a nurse who has succumbed to COVID-19. So probably the first case of and so how do you see this in terms of for people to understand why we are highlighting and emphasizing healthcare PPE for healthcare workers? What is the risk for healthcare workers, and what kind of support are they getting, or what do they need?
As of now, I'd say the risk for health workers or anybody working around the hospital or clinic is very, very high. I think I know you've been able to see some of these. I think since the time coronavirus was announced to be in the country, I think there have been a lot of things happening. You've seen health workers striking due to inadequate or lack of PPEs. That hasn't changed, and as of now, it still goes on to be the issue. Of course, people are not rioting, people are not striking, but it's still there. The risk is still there. And as you can see now, the data, the way the data is showing, is like there are more cases of health workers just trying to prove to that point to say there isn't much that is happening to protect the health workers. And there's still a higher risk when somebody's working at a health center or a health facility. That risk is there and is significant.
Right. Actually, I just want to do a PSA, public service announcement for all that are watching, especially our family members, our communities in Malawi, to remind everybody, please treat healthcare workers with grace. They are putting themselves at risk for the sake of Malawi, for the sake of patients, and their families are also at risk. So when you see them, treat them with grace. Don't discriminate against them. They're doing this because of their love for humanity. So whatever we can do, let's protect them, let's treat them with grace, and let's be thankful for what they are doing. We should not at all discriminate against them. Similarly, when we see someone wearing a mask, we should not discriminate against that person. If anything, wearing a mask is the thing to do right now. That's the most fashionable and most objective thing to do. So please, 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 let's practice social distancing. Let's use face masks. It doesn't have to be expensive. Tailors are making them. So cloth masks are important to protect yourself and to protect others. Actually, an act of love right now is to wear a mask and to socially distance from others. So in terms of that, I want to bring in Dr. Matipwiri. How do you see this fitting into the mission of LifeCare Malawi, where you're looking at a person as a whole person rather than just one aspect? Because that's something that's unique with this foundation. It's not limited to one area. So if you can address that a little bit. We can't hear you. We can't hear you.
Okay,
Yes,
can you hear
thank
me
you.
now? All right, thank you so much, Dr. Sam. I'm glad to be part of this and just to look at our organization. Uh, Me, myself, as one of the medical practitioners here at LifeCare Medical Center, uh, we have a vision. As a team, we work together in making sure that people are educated and people are able to understand about prevention of diseases. And also, they have to understand that some of the conditions can be treated at the health facilities. And we also look at food security. As part of treatment to most of the diseases, and humanitarian aid, looking at the support that people need uh, in terms of like beddings and whatever they need as their uh, basic need. We also look at that, and also looking at community development. It's more of like providing those skills that can help people in the community to sustain themselves by getting uh, some income. So when we are looking at the person, we look at as the whole. And right now, with the condition that we are having, this COVID-19 pandemic, it is pretty hard to implement most of these programs, but we are able to uh, like try our best to support the community at large. But due to limited resources, it's pretty hard. It's pretty hard even to protect the patients and even to protect our staffs. But we are trying our best to make sure that some of these things we are able to provide to the community that we are serving.
So, yes, the holistic and the considering the culture and the economy of Malawi, it would be hard to say there should be a complete lockdown. It has to be a specific strategy. So, in your experience, in terms of the people you are serving, what has been the most effective in reaching out to them? And after that, I want to ask you a question on collaboration. But first, in terms of the various communities, what has been the effective way to reach out and educate?
Right now, what we are doing it's more of like leading as examples, like at our facility, to make sure that each and every person who is coming to this facility is having masks and also is able to wash hands with soap, and all the team that are serving the community, they are able to put on PPEs. Um, and also like in our communities right now, because of the restrictions that are there, we are not able to go like to have a mass meeting so that we can give out the information. But what we are doing here, it's more of like talking to them when we are seeing the patients here. We remind them about COVID-19, and we have plans to make sure that we have like peer system that we can be able to go within the community and keep on reminding people to wash their hands and to remember putting on their mask and just trying to provide that better education to the community. But as of now, we are mostly like working on the ground, like at our better facility to provide all those with the signpost and everything.
Thank you. And just to remind everybody, in terms of the funding. LifeCare is our implementing partner, but they're not just going. The funding is not just going to the areas where they work. The funding is going to be spread across various areas in Malawi, in the north, in the central, in the south. So we're spreading, but they are going to be coordinating all the activities related to the provision of the funding in the various areas. So, in terms of that, as a final word, can you give us just a quick minute overview of your experience with others? Have you collaborated with other organizations? Because that's something people would want to know.
Actually, like for LifeCare Malawi Foundation,
Yes.
the first partner is Malawi government.
Mm-hmm.
So we work with the district and also the like the district hospitals within the places where we are serving. And also when we are looking at supporting, we normally collaborate with the district and district social welfare coordinator and also the C, and we go and assess the total facilities that we uh, identify. So once we assess all those total facilities, and we also analyze whether the facilities are eligible for the support, and also we look at their needs and we try to get their needs. So actually, right now we can say like the big partner it's Malawi government. So we work with the also the mission hospitals, uh, so that because most of the mission hospitals they have their health facilities like in hard to reach areas. So when we are looking at where we can support, we look at those areas. We said this program, we would like to go to Nzimba, and where that facility is in need. A lot of people go there. People who are coming like from Zambia or Tanzania, they also go and access the services from there, in which there is a need. We wanted to go there and help so that the people, the medical team, as well as everybody who is working at that facility, should be able to be protecting themselves. Uh, and also, we plan to go to Nchewu, where that facility is also having a lot of people from Mozambique. We are going also to support that facility. All these facilities, we get them and identify them from the DC and the district health officers, the doctors, and we go and we assess the facilities.
Wow.
The
Wow.
one we have like in Vumbwe, that is almost, I can say um, maybe 5 miles from our facility because
Yeah.
it's a
Yeah.
health facility. It's a health center. It's one of the big health centers. It receives like a lot of people, and we thought of like going there and support because we are kind of like sharing the patients. So they
Perfect.
need to be protected. We are protecting ourselves right here in Banda.
Yes, thank you very much. This is very informative. And half a minute for each one of you. What is your final word? What do you want people to know? Whether in Malawi or the diaspora, what is your final word?
My
Yeah.
My final word would be hope. That we
Mhm.
just have to remember this is the third poorest country in the world. I came from one of the richest countries in the world. I came here because I have hope um, for people that are poor, people that are hungry, people that need education. We have to have hope. And I believe in that firmly. People keep asking me when I'm going back to America. And I say, I don't really have a plan to do that. I live here and I want to help.
Mm. Thank you. Thank you. We appreciate that. We appreciate that. Dr. Chinomba? So help, as you heard, help. And on the bottom, you see the scrolling button is showing you various options for donating: Cash App, GoFundMe, Zelle. Please, no help is too little or too big. Just whatever you can afford, please give. It's blessed to give than to receive. So we appreciate that. Dr. Chinomba, we can't hear you. We can't hear you.
Yeah. So what I would say as my final words is say COVID-19 is real. I think as for Malawi, initially it had been taken as if it was just something minor, something little, or something political. But reaching to this end, 4 months down since the first cases were identified, I think we've seen a lot. We've uh, we've seen very close people, close friends being affected or others dying. I think it is indeed real. And looking at the figures, how they are going up, they are really spiking. And if we are to go at that rate, there will be a lot of things that I think will go wrong as a country. So my word is just say, indeed, COVID-19 is real. We need a much dimensional approach, a disciplined approach to make sure that we elevate the condition of the disease. We need to put our hands together. All of us, we all have got a unique way in which we can assist the country. So we appreciate all the support that would come towards the direction of COVID-19, and we hope it will make a huge difference. And if there will be many organizations as well doing the same, I think it will translate to a lot of difference on the ground. Thank you.
Thank you very much. We appreciate once again. It's Malawi Diaspora USA, various organizations in the USA are coming together. And finally, Dr. Matipwiri, what's your final word?
Oh, yeah, thank you so much. I would like to thank the diaspora, wherever you are. We are very excited to hear this news of supporting Malawi through PPE support project. I think uh, you have chosen the right implementing partner in Malawi, and we really appreciate for choosing us. And also, you have to trust us. For us, we are going to do our because this is our passion. We have medical staffs that would like to be protected. And also we have volunteers who would like to be protected when we are going out, when we are planning to reach out to the community. And this support, it is going to start with us protecting our staff, protecting our volunteers as we are going to help other institutions and other people who are in need. Really appreciate for this, and thank you so much. We are going to make sure that any dollar that you have donated, it has been it has been given like a very big impact to Malawi. So we really appreciate for the support, and we will continue giving you the updates and the reward and everything that you need from us at any time. We are very much flexible, and we appreciate for your support. This is going to help Malawi so much in the social care way. Thank you so much.
Thank you very much. Actually, we appreciate, it's getting late in Malawi. So the fact that you were willing to stay up to connect so people could see you, it's always important for people to put a face to the name. This is very important, and you have given informative details about the activities of LifeCare Malawi and what you're doing. And we have no doubt, and we just wanted, because we want to assure people who have donated that their money is going to a credible organization. And now they have seen what you're doing, and they will find more information on your webpage, where you list comprehensive information of the various programs that you're doing. We appreciate all that you're doing. We know you're putting your lives on the line for the sake of Malawi, and we don't take that for granted. And to all our sponsors, we want to assure you there's accountability systems put in place. We have signed a memorandum of understanding. So there's a document that is legally binding on both parties. And so moving forward, we know that we're going to be able to be getting back to the community every so often to update people on what's going on. And we hope this is the beginning of many collaborations in the future. So thank you very much. And we're going to, I don't want to hold the program back, but definitely it's very interesting information, which we could continue talking. But of course, in the interest of time, I would like to hand over to the host so that we can move on with the program. But definitely, this is exciting, and it gives us hope for Malawi. There's so much good happening in Malawi, and we need to be talking and talking about the work that people are doing on the ground. So we are happy to be supporting this organization, this fine organization. Over to you, Christina, Aid, and Ken. Hey, hi, Ed. Yes, how are you feeling about this organization? Now
oh my goodness. I mean, I'm a little biased when it comes to LifeCare because we just have so much history. And what was amazing was when we started this. Remember when we were talking about who are we going to work with? The last person I thought was Pax, and we kept thinking of all other people. And then one day it was like, wait a minute, LifeCare. What are we doing? Not contacting this, and what even makes it helpful for this is someone who has traveled abroad. He has seen what accountability is like, so he understands the process. And even when we approached him, it was always the first thing he did was send us videos of projects that he has done on behalf of other organizations from outside, pretty much showing us here's how we put our reporting together for our donors. So he includes not only the written word, but he even has videos that he documents to see, for people to see what he does. That's why so many organizations trust LifeCare when they want to approach Malawi. And this was really a nice touch going into all of this. And like you said, this is just the beginning, because it's very hard to find trustworthy partners. And when you find them, why not hold on to them? And with the way things are going, we know, even though we said this campaign, this is a finale, we know the worst is about to come. So we are not ending here. Yes, we will stop here so that we can take this money and go, send it home so it starts working now. But we know that there's no way we can sit around when things are actually just picking up and getting worse every day. So stay tuned. We are going to definitely work on getting another campaign going. It's hard work, but we are blessed to be in the position we are. Yeah. And besides, we are on lockdown, so where are we gonna go? Gives us something.
There you go.
Gives us something to something to not get bored out here. But it's once again for a good cause. For the people in Malawi, honestly, the health workers, if people that are here with all the equipment are getting infected and getting exposed every day and really suffering from COVID, and they have the equipment, imagine our people. Right. They've had to take on public transportation, and one thing that I am really not happy about is the stigmatization of these workers. They are going to work, and people not willing to even give them transportation to go to work, and then expecting to have them take care of us when we show up at the hospitals. And that's something that I really would like people to think twice. These are going to be our heroes. These are the forgotten heroes in this war. These are going to be the people that Malawi will fall or rise with. And if we don't take care of them, it's the whole nation. That's 18 million people that will be at risk. Yes. And we already are understaffed. So the people we have, we must take care of them day in and day out. One of the things as we're going through the list was had asked Dr. Matipwiri what else he needed. And we were thinking about, we're going to get aprons that they can wash. And he said, no, we need disposables. And that's why we need so much money to really get these disposables. Because he said, if we are treating a patient, it's risky for us to take that and start washing instead of just taking it off and throwing it out somewhere in a trash that's also secured. So that's why we need these funds to go out and start doing the work. It's the little things that actually are most important: the masks, the gloves, the disposable aprons, the headgear, all of these things that seem so simple, but we saw how much they disappeared from our shops here. For months you couldn't find gloves. For months you couldn't find masks. They've just started coming back. Now imagine that's in Malawi for health workers. And so we have to do whatever we can to help them fight this. I want to acknowledge some of the people that we reached out to, because we are here. And for us to get information of what the situation is, yes, we can read the news, but you always also need people that will tell you the good and the bad and the ugly. And two of the people we appreciate that reached out and were always feeding us with information that we could verify was Dr. Lucien Kandawirevam and Dr. Kaboni Gondwe. These two people were in constant communication with us, being able to answer our questions, because you also had to know the system within the system, and so these two supplied us with valuable information that we could be able to use in our decision making. The suppliers we are working with, Kentam Products Limited, that's all over in Malawi. They have been there for years and years. Bioclinical Partners Limited, these are great companies, 100% owned by Malawians, that they are giving us good products. They gave us good prices. And so it's also a good thing to know that they were not just looking for a profit, but they were really looking to help out. Of course, they're not going to give all of that for free, but we know they're going to throw something in for free. But at least we were able to reach out to them. They were able to even tell us, hey, here's what you actually need, instead of just saying, okay, what do you want? They really stuck to it to say, yes, you may want to use this, you may want to use this. So it helps us even stretch the dollar even more. So we are very appreciative for that type of business partnership. So tonight, we still have the program going. I'm looking for my other hosts here to join me. But we have a performance coming up for Chris Ntaka. Most of you, or the older generation, may know him. He was playing with Like a Dube back in the day, when Lucky Dube was just coming up on the scene and blowing the international charts. And we all grew up thinking, man, if I can learn the guitar, I could be able to be Chris. So I'm excited to see what he's bringing to the table. I think he's touring today with, I was going to say Hugh Masekela, but I realize he's gone. But he's doing a show, I think, today with somebody here.
Yes, so we're going to have that in a minute.
Yes.
And before we have entertainment, so after that, I will do a little introduction of him, a little bio of him. But I just want to warn or encourage our viewers to bring in your friends, to bring in your family. We have some entertainment coming up for you. But I also want to just say thank you so much to Dr. Matipwiri and also Dr. Chinomba and Chaplain JoAnn for being here with us today and for being our partner. And as Eddie said, we've had so many conversations with so many people because again, Mudu Modi Susan Zadenga. So this work, it's all about us. And you heard it in the informative segment to say, it's all of us have a part to play. So for us out here, we're fundraising and you are contributing to all this. So thank you so much for what you're doing. I also want to acknowledge that you noticed that Dr. Chinomba and Dr. Matipwiri would mute their lines when one was talking. They were in the same place, but they practiced social distancing, which is one of the precautionary measures you can take to actually help yourself from contracting this virus. So thank you so much for being good examples of what needs to be done. We're not only buying them, you can wear a mask if you want to go out, but the social distancing also helps, and also washing your hands. So thank you again for being examples of that. So you saw our partner, and now you know that this work is real and we're just not joking. So get out those wallets, invite your friends, donate, and maybe you donated in the past, but you're like, oh man, there's really more to be done. Yes, here's an opportunity. And I also want to just tell you some of the statistics again, that right now in Malawi, it's 3,557 people who have the virus. So the number has been increasing. At first we'd hear, oh, one person, 2 people, 3 people. Now I literally know family, friends who have passed away from this. So 3,000 people who have, and 103 new cases as of today. So this thing is real. And so let's go and keep contributing to this. And again, I think we have faith we can get to 20,000. And that'll get a little bit. And so you don't want me to go rob a bank. You do not want me to go rob a bank. So if I don't want to go to the Reserve Bank of Malawi to rob a bank, some of you might know what this means, but I don't want to go rob a bank. So help us raise that $20,000. And again, for you to donate to this, it's Zelle, PPE4Malawi at gmail.com, PPE4Malawi at gmail.com, Cash App, MDN, the $ MDN Malawi PPE. And GoFundMe, MDN PPE for Malawi healthcare workers, for healthcare workers in Malawi. So thank you so much for being here. And how about we go to some entertainment? And as my friend Eddie said, the featured musician today is Mongezi, Chris Ntaka. And he's a township music guitarist who has really worked with so many prominent people on the African continent. He's played with Lucky Dube, so Vusi, he's played with Hugh Masekela, and so many amazing artists, Oliver Mtukudzi as well. So, and he started his guitar with one of the Malawi's greatest guitarists, Daniel Kachamba as well, and also Malekula. And his guitar style is rooted in Malawi and in Southern African tradition music. So let's get some entertainment rolling here. And as you're doing that, remember to also open your wallets. Again, you don't want me going rob a bank. So let's do this together.
I like the mask.
You don't want me to go rob a bank. No.
By the way, Ken, please send a brother a bottle of gin, man.
Hey, you know, everything blessed by Malawi.
Oh yeah, love
that's
that.
What we do. We have to represent Malawi wherever we are. So somebody told me when I was young, a little story. One representation of a man in a foreign country represents everybody. So if I make a mistake, they don't say Ken made a mistake. they say Malawi made a mistake. So what we're doing here, we have to represent our country, right? Our country of Malawi and even our own country here of the USA. So as you see in the back, if you can see, there's two flags: the flag of the United States, which I played my legends, and the flag of Malawi, which I played my legends. But tonight's Best by Malawi. Anybody that's going to donate $100 is going to get a bottle of gin. Please send in your request. DJ Kano is going to be on the deck in about maybe 10, 20 minutes after Chris and Ntaka. But ladies and gentlemen, please enjoy the entertainment coming. Just a sample. Wait, you mean a sample? We'll be right back, ladies and gentlemen.
Nice.
But in the meantime, we're going to give it to Chris and Ntaka. We'll be right back. Don't change the dial.
I have my gun warrior, by the way, if you can see him, ready to protect all the money we collect today.
Love it.
Thank you.
Yes.
Thank you.
Hello, everybody out there. This is Mongezi performing a couple of songs for you during this time of raising money for the PPEs for Malawi. And I'm going to play you the first song that I'm going to perform is a little meditation piece. It could also be like a lullaby, something like that. But this is the kind of music that you hear mostly in Central and Southern Africa. It's played by it's played on kalimbas or mbira, those kind of instruments. Some people call them like thumb pianos. And this piece is about a traveler, a traveler, and it's like unknown. The title of this piece is like unknown, because this is like a soul that's in search of a better life, and so working hard, going over the place, looking for a better life. So I came up with this song years ago, and so The Unknown. just a traveler. And the next piece is the same style of music that I'm going to play for you. Also performed mostly in Malawi, Zambia, Mozambique, parts of the Central Africa, the Congo, Cameroon, Gabon, Zambia, Zimbabwe. So this is also mostly played on a thumb piano and the kalimbas, which are like really some of the most accessible instruments by the indigenous Africans there. And this one's called Daytime, daylight. That's what it means. Same concept of somebody who's looking for, hoping that things get better, that his society finds a way to make things accessible to everybody. Like in these trying times we have where people are searching, they're looking, they don't have much, they have lost their way of making money. Right now it's only rich people that are living normal life, and so they're telling us that all things going to be good, is going to go to normal. So here's the second song that I'll play for you. I call this Emini or Masana, Daytime, Daylight. It's the same idea of a traveler, somebody who's always looking for a brighter future, or people that are positive. So it's a good song, or it's a good story to tell in these times when people around the world are looking for any help they can get, especially those that will need protective equipment so that they can escape this virus. The PPE4Malawi. So donate what you can and help what you can. Help with finding partnership with people around the world, because, like they say, we're in this thing together. So here's Emini. That's a mini, a song about a traveler, somebody who's always looking for good things. And there's so many people around the world, especially in Malawi, that are looking for the PPEs, things that they can use in hospitals or just to carry on with everyday life to protect themselves from this virus of COVID-19. So help out where you can. They need our help, your help, my help, his help, her help, everybody's help. Try to get it to get through this pandemic. Thank you.
Wow, amazing. I almost forgot that I was supposed to be part of the hosting crew here. But I've adored him since I was a kid. As you saw, he has played with Dave Matthews. You don't play with Dave Matthews unless you're something. So he is at that level for those that don't know him. Once in a while, in a few years, almost like every few years, I get to see him do something like this when Malawi isn't doing something charitable. He comes out of the shell and performs. So it's always great to see him that he always, as busy as he is, he always takes time to be able to do these kind of things when he's asked, because he's always traveling. He lives right here in DC, but he's a global trotter, but he always takes time to do this. So it's appreciated.
Yes, and the fact that he's able to take time out of his busy schedule is that he believes in this work, and you heard it. So if you kind of agree with us, kind of dropping that $10, dropping that $20, and we have so many people contributing in so many ways. So again, thank you for being here, and we encourage you to even support us in that. So this next segment, I would like to just again take a minute to appreciate the production team, because this work would have not happened without those talents and those brains and the efforts of this group of individuals. And at first we had announced the people who've been kind of behind the campaign, the organizing committee, but this specifically for this show to actually happen, we had Dr. Sitinga Kachipande on the production team, and we had Changa Kamwambe all the way from Massachusetts. Thank you so much. And this person I'm going to recognize next, this is a special really recognition to our graphic designer or our graphic artist and also director, Marvin Kaulembe. Thank you so much from Colorado, and thank you so much for taking time out of your own business, Snapdrop, and check it out, snapdrop.inc, media, Inc. And so check it out. He's been fantastic. His technical, amazing work. You can see like what is producing. This is some really industry level work. So thank you so much. We have not really done all this without you. We appreciate you, Marvin, and we hope you continue to work with us. No, we hope. We know you will continue to work with us.
Oh, he better. We know where he lives.
That's no choice. He believes in the work, actually.
Yeah, it's one of those things I always say, when he joined, just kind of like joined, didn't know how he was gonna fit in, and then he just kind of volunteered. Oh yeah, I can do a little bit production, but we underestimated what value he was going to bring to the table. And really, I just thought, oh yeah, it's a poster here, a poster there. But we ended up that everything that we're doing goes through him. He never complains. We changed so many times before this, when we were prepping behind the scene, we were changing the logo. And he was like, oh, just give me a few minutes, I'll do it. And sure enough, boom, he's got a logo going. But it's a talent that you can't easily find. And he did it all for free.
Mm-hmm.
Did it all for free.
So thank you so much, Marvin. We recognize all your sleepless hours and all your leadership in really getting us all on the same page to figure out what we're doing. And Ken Malomboza, thank you so much for being part of the team as well. Patricia Saka Kamkondo, thank you. Elisa Montali, amazing project management, I'll say leadership there. Thank you so much. You have put in so much work. And Mwiza Muntali, thank you so much as well. Today he's back in stage kind of directing us as well. So thank you so much, Mwiza. And Chatonda Mtika and is also one of those who just jumped on and said, okay, I do in this work and I'm here to help. Thank you so much for helping us figure all that out. And
yes,
also the one and only Eddie Namingona. Thank you so much for the production team. All this would have not happened without all these hands chipping in. So thank you so much. So this next part,
oh. And a big hand to you, Miss Christina Kankosi. You make it seamless. You know, these hosting gigs, I just follow pretty much. We show up and we follow, but you're always leading, you're always doing your thing without people asking you what to do. And it's always great to do this with you. We've been on numerous conference calls, so many people that spend 2 hours. When we do it, we always say, oh, we're going to be here 1 hour, but it ends up being so much time that we work here. But we are very appreciative of your contribution to all of this.
No, it's been an amazing gig. It's been an amazing experience to work with everybody, and looking forward to a lot of opportunities to do so. And so next up, we are going to roll in our DJ. Are you ready?
Yes.
Are you ready? Okay.
Oh,
so
yes.
We're rolling our DJ, and I think I would like to request a song. He said that we can request songs actually at $10. So I'm going to request my first song. I might end up with 10 songs because this DJ is amazing. So get those dancing on. And so my first song I would like to actually ask from Ken is anything from Lulu from Malawi. So I'm going to just take it home all the way. Lulu.
Nice.
I'll be putting my $10 in Zelle right away.
I'll be broke because I want two things. I want the songs and I want that bottle. So,
all right.
One or another, I'll be broke by the end of this.
It's for
a good cause.
It's for a good cause.
Eddie.
Yes, sir. Yes.
You asked for a song. I'm going to play that song first for you. But how about you and me? We match. We get the ball rolling. I say I put $25. You put $25.
You got it.
I like that.
And Christina, since you're a host, you're on it. So we got $75 for this one song. I just put you in. All right.
We're kicking it up.
I have to get $75. All right, DJ Ken.
It's a magic man from the moon. Yes, herbs and beats for a wish. Stands on top of a mountain where it speaks to all his children. Looks down through sunny skies, spreading the magic message. Southern peace and happiness, and celebrate the joy of life. Singing magic, coming out of the sky. Singing magic, it never dies. Singing.
Okay, I think we lost the sound somewhere.
So yeah, let's work on that a little
Yeah.
bit. And as Ken is working on that, I'm going to remind folks to say again where you can donate. It's on the GoFundMe. On the GoFundMe page, you can find our MDN link and PPE for healthcare workers in Malawi. So please donate on there. And we also have Zelle, and we also have Cash App. Tell us the details for Cash App and Zelle, Eddie.
For Zelle, it's MDN. No.
The money sign. MDN.
The man is MDN. Sorry, can you hear you?
I wanted to see where you've been sending your money. What else the text? I'm like, this guy's been saying he owes us money. He's been sending it. I wanted to make sure you're sending to the right. You're not sending money. So as this guy is trying to figure out where you're gonna send money.
I swear I've been sending money.
So you're gonna send
$ MDN Malawi PPE. That's the that's the Cash App, and then PPE4Malawi at Gmail. That's the Zelle.
That's
I swear I've been sending money, but somebody needs to recognize me.
What is he doing? Where is he sending this money? Anyways, and talking about bets and whatnot, I think Mwiza Muntali, owes us money.
Yeah, I think he does. And you know what? I thought he was going to be part of the hosting crew all this time. I hear he shaved out his. He showed me that he shaved out his lockdown shag that he had.
We need to bring him out.
That.
Imagine that in the background, but we need to bring him out. And
yes,
$25 for just
except for belling on us.
You guys hear me now?
Now we can hear you.
Okay, so I just want to give up to my brother Makaika. He's putting another $25 for just that one song. So hey, Makaika, what's up, man? All those guys from the UK, you guys can donate to the pounds. Which thank you, Makaika. You can see that banner over there. Thank you, Makaika. We appreciate you, man.
Thank you so much for doing that. Yeah, great work. I think we'll get to $20,000.
Oh, we should.
Should I bring the song back a little bit?
Yes.
Let's try this. Let's try this one more time.
We're ready.
This is what happens with live shows.
Can you hear me now?
Still, we still need it higher. We've lost the sound again.
Ken.
We keep losing the sound. I don't know what's going on.
Ken, can you hear us? Ken. He's jamming away.
He's in his own world right now. You can't even disturb him. And I was looking forward to that Makasa song. I haven't heard it in a while.
Right.
It's no, actually, that is kalimba.
I don't even
Yeah,
know.
reggae magic. Yeah, yeah, I think that's kalimba.
Oh, that's just the
Yeah,
one
that's
now.
the one reggae magic, the one he started out with.
Just
Yeah,
so
I think
you
that is-
know, whether you play the song or not, you still pay. You still give us the money.
I'll pay half of it.
No,
I could only hear half of it.
I'll be watching, and this is for PPE for Malawi healthcare workers. And Eddie posted apparently some songs, 5 of them $50, and he's also getting that for 100. So $150. Thank you so much.
So here's the thing: whether we still hear those songs afterwards, he's gonna have to call me and play those songs. I'm getting my money's worth. It doesn't matter that we're not sharing the songs now. He's gonna play those songs until I hear those songs today.
I think I like that idea. I like that idea.
Yeah, but in honest speaking, I still would like to hear Mongezi. I don't know if he's in the background there that he can, we could have him as a host. I mean, as a guest. How about that?
All right, Mongezi Muntali, how about we have you here on in the studio, like for a few minutes, and we quiz you. He's the source of our wisdom. Any book that's out there,
know, right?
Important. Mongezi is our guy.
Mongezi is our guy.
You guys are put me on the spot.
Yes.
Can you hear me?
Yes.
Yes, we can.
No, you're talking about Reggae Magic. Okay, that song came out in 1985, and Kalimba was going through a split, and so the song came out under Makasu.
Oh, okay.
Oh, okay.
Yeah, first song, yeah.
I told you.
See,
you want to know his story. Like, this group is so dynamic. Like, we have.
I know.
In here.
Yeah, 1984. So that song came out 84, and then they were going through the split, and then there was a dispute about how when they recorded it and all that, and then some people became Makasu, and the other guys stayed as Kalimba.
Yes.
So Kalimba continued.
And I remember we had one of the early Kalimba guys here. What was his name? That was here. He was playing the sax, but he passed away a few years ago.
Oh, okay.
He was in DC. Do you remember him?
Oh, you're talking about not Sidney Banda. No, Sidney Banda played the sax, but he wasn't with Kalimba. Not Sidney Banda, right? No,
wasn't he?
Yeah, was he? I'm not sure. I think it might have been him. Yeah, I wonder if his.
Yeah, in the early.
Long time ago, yeah. And he used to play in the DC clubs. And he was also a car repairman. He actually fixed cars as well.
Wow.
Right here, yeah.
I met him once. That's how I remember. My father introduced me to him when I came here. But I never got a chance to see him again before he passed.
Yeah, that was Sydney.
Yeah,
Sydney Banda.
Yeah, incredibly talented.
Yep. So yeah,
these guys, when you look at the kind of musicians we had back then who could play instruments that people pay thousands to learn, was incredible.
Oh yeah.
It was just
like
incredible.
Chubby, the guy in Love and Love Aquarius. That was a big group back in it. That's before your time, but
I know Love Aquarius.
Okay. Way before your time.
I know Love.
Okay.
Gas Machine Head. Remember them?
Yeah.
I didn't realize they were doing rock.
Yeah, it's like rock and roll, yeah.
I loved it.
But I'll give you another trivia. There's a guy who played football and for the national team, and he actually, I even saw him singing as a little kid at a wedding. Guess who that person is? Yassine Osman.
Oh my goodness! Yassine Osman.
Yeah, he used to sing.
Wow.
Once in a while. Yeah, I don't know what band it, but yeah, he's one of those. That's a little unknown, little trivia, but yeah.
That's amazing. What other questions do you have for us, Lisa?
So, well, I did pay up because you said I should pay up. So I since he played Reggae Magic, okay, I had to pay.
Thank you for honoring that.
That was my request. So I said, okay, since he played it, I'll pay.
Thank you. I appreciate that.
You guys, one thing I was gonna do, I was trying to get a surprise guest. One of is it Frank Manifumbo, who had COVID, but he had an engagement, and I was really trying to see if he could speak on on that view of what he experienced.
What he went through. Yeah.
I had sent a message to Daud Suleiman, but I don't think he saw it. I made a mistake and sent it on a group text to say, "Man, we're doing this. Can you be able to join?" But you know how text get buried, but I thought he would also be a great host. I mean, a great guest to just speak from that point of view. He had a video out that talked about how appreciative of the health workers he was. It was, he just explained his whole process and how these people just gave him their all. And so it gives that back to what we're doing here, how important it is for people like him to have survived. And he was a big important piece, as we know, of the Malawi politics right now. And it would have been such a tragedy to lose him. We've already lost a lot of people who fought hard on the campaign trail for all parties, and they're not going to see what the future Malawi is going to be like. And this is what COVID is doing.
Right.
And for us to prevent more and more tragedies like this, we need us to support our healthcare workers, because if they're in good health, they'll be overworked, and not only overworked, but working under stressful conditions. Because having a mask, when I go shopping and I take a mask, I get a mask on for an hour. By the time I'm done, I'm just like, I'm just ready. The moment I get out of the shop, it's off. Now imagine for them 12-hour shifts, even some of them 24 hours. They're just having it, and you're smelling your breath after 1 hour. You just begin to know how bad your mouth can be, and we need them healthy. And what we're doing here is going to protect them as much as we can. So guys, please add another $10 for a request. I don't know if he's ready, but
can you guys hear me now?
Yeah, we can hear you.
So we can hear you.
Hey,
The music.
Just on the trivia, Muiza, on the trivia, Love Aquarius, Kid Kandawide and Wellington in Kukupa.
Okay.
Oh, Kid was supposed to come here in May. If it wasn't for COVID.
Kid Kandawide and Wellington in Kukupa. I remember them back in the days when I was a little kid in Kuala. I'm a leather. If you want to cool on the gang. Those guys, they had like Killer Kid and everything. But anyways, you guys were talking about Gus Machine Head. So I'm going to play something from Gus Machine Head. $10.
I am in.
Right.
We can't hear you. Oh man, what is going on with the music?
We can't hear the music. Is it plugged in?
We can hear it. We can hear you.
We can't hear the music.
I don't know, but can you guys hear me now?
We can
hear you, but not the music.
Not the music.
We can hear you, but not the music.
I don't know what's happening with can you hear the music now?
Kind of fading. It fades in and out. It starts
in and out.
Yeah, it starts and then speaking of Suleiman, by the way, he was on another
okay, give me 5 minutes, let me get to it.
Suleiman was actually on another Zoom thing talking about COVID and his experience together with it's another event that took place just before our event started. And it was Suleiman and also Minister Timothy Mutambo and others.
Oh, I missed it. Too late.
Yeah, and then the nurse, I think she's here, Chisiza. Doreen Chisiza was on the nurse,
Oh,
and they were talking about
New York, isn't she?
Yeah, I think so. They're talking about the issue, and basically echoing what we've been saying, the needs of healthcare workers, and then also having a strategy within the country, and it's an emergency situation. So, very good piece. And he was talking about his experience. He's now on day 12. I guess on Monday will be on day 14. Yeah, and he's just talking about the mental issues that affects you when you're in solitary. Basically, it's like solitary confinement when you're under quarantine.
Yep.
It's a very fascinating discussion. Hopefully, if it comes out, we should share it with people when it comes out.
Yeah,
because I think
another
biggest problem I'm having. Oh yeah, go ahead.
I was just saying another person too who a lot of people know who had COVID was Alan Gumuya. And we've also been talking about his experience as well. So as we've been saying again and again, this is real. This is not a hoax, as some leaders say. So it's very important, and your money is literally going to save lives. And if we take these precautionary measures.
Yes, I was for Alan, actually that hit home, close to home, because he had just gotten in contact with one of my cousins, who ended up going back home to the village to see people. And so when we heard, it was like, oh my goodness, you've just met him, and then you went home to see Agogo, what's going to happen? But like enough, there was no transmission between him and the cousin. So that's great. I managed to talk to him briefly when he was I think still in the hospital, but he texted to say he was doing great. So I'm glad to see that he's up and running. But yeah, this is not discriminating. Doesn't matter whether you're rich, you're poor, short, tall. It will get you if you're not careful. And the biggest fight we have now is trying to convince people at home, even my own mother, trying to convince her to say, you can't, she's somebody who people always rely on in the village. When somebody gets sick, she's there. And I think there's that struggle of trying to not appear as if ubunyade by putting on your mask and doing the social distance thing when you're trying to help someone. And been saying, can you at least put on a mask and get your gloves, because you just don't know. A lot of people think it's malaria when they start out, and a lot of people, several people have actually said, even Dowd himself, he was diagnosed with malaria coming in, and then COVID later on. So people think it's the same feeling because it attacks differently. Some it's the lungs, some of them is just their stomach, just like a flu, you're having diarrhea. So people may not actually think something is going on because they are thinking, oh, this is malaria, and you know how malaria does. And by the time they realize this is more serious than that, it's too late. And my fear is this culture that we are in, where we are always visiting someone when he or she is sick, somehow has to be scaled back. We have to know that not only are we protecting ourselves, but also we protect the patient. Because if the patient doesn't have COVID and we're carriers, then we expose the patient to the COVID. So as much as we want to help, we may actually do damage to that. But it's a struggle. Like I said, even my mom, it's been a struggle every day. I'm like, please, mom, don't, be careful, be careful. And my brother was like, man, sometimes she puts on a mask when she actually sees me coming. I was like, he's like, that's not how you're supposed to put a mask. You're supposed to do it when I'm not even here, But I'm just praying that it doesn't get to, especially to the villages, that it doesn't get there, because that's just going to be devastating, because people will not leave you alone. Nobody's going to say, oh, we're just going to put him in the room and feed him from here. No, people will want to be there, and it's natural. So I'm hoping that we don't reach to that level. But even if we reach to that level, that people can still realize they have to take precaution. And like I said, this is not just for them, but
for the other person
as well.
Somebody has made a little meme that's saying, wear your mask as if somebody else's life was dependent on it. And I'm like, I can concur with that. Ken, are you ready?
Can you hear the music?
Not really. We hear you, but somehow we don't hear the music. It looks like it sounds as if it's not connected somehow.
But you guys can hear me, right?
We can hear you perfectly.
Okay, hold on. Give me 2 seconds.
Yeah, sure.
We hear it like in the background, like really underneath you.
But really?
Yeah.
That's very strange. The music is loud as it could be, man.
Yeah.
I don't know why you guys can hear me, but you cannot hear the music. I used the same system last time, but oh man.
Well,
we'll try another way.
I'm gonna go in the background. I'm gonna use a different device. Let me talk to Mervin. Hey, but you guys, you can still donate while we're going through this.
And I was gonna ask Eddie if anybody, if you see anybody from donating from Cash App and Zelle.
And like Eddie, we can do music on demand. So let's say you want to hear specific music, we can get Ken play that music directly to you between now and next week.
Me.
I just volunteer them. So if you're like, I really wanted to hear a certain song, so we can get music on demand for you. Have Ken call you and play this.
He will have to.
For you, yes.
He will have to. I'm not giving up on this.
No, not at
all.
I
want my money's worth.
Yeah.
But going back to this COVID discussion, so I would just put it out there and say I have not taken the antibodies test yet, but I work at a hospital, so I think I was exposed. I think I had it. So what's making me talk about this is the fact that people felt like they had malaria. That's how it started for me. So headaches, it started with these big migraines and headaches, and my tummy just couldn't settle. So a lot of GI issues. And then 3 weeks, literally, I slept for 22 hours. And I was like, how in the world can I sleep? So it's real. And I encourage people to literally take precautions. And other people are like, oh, I'm young, I can get it. And sometimes other people, if you're lucky like me, I had mild symptoms. They're calling those mild symptoms, but it was really miserable. So I urge you people, I will need to confirm later with an antibodies test, but I could not smell or taste anything for 2 weeks, literally 2 weeks. So I remember eating this burnt plantains because I was so weak. I was tired and I couldn't cook. I couldn't stand. So I was like, what do I do? So I attempted to make these plantains and I burned them because I was sitting down. I couldn't smell it. And I ate it because I couldn't taste anything. So so this is real. Other people have symptoms. So again, our culture, as Eddie is saying, we go visit sick people. We go to funerals and whatnot. But my friends, take care. Just be careful. Because this one is not discriminating whether you're young, older, and pre-existing conditions, whatnot. And here in the United States, unfortunately, it's also in terms of disproportionality. Black people, brown people are dying at a higher rate because of other systematic issues. So just be careful out there. Wear your mask, wash your hands as much as you can, and social distance if you can.
So, can't stress that more.
Yeah,
you cannot stress that more at all. It's sometimes it's like you're young and you feel invincible, but this is not something that I want to test. It's almost like that saying in Malawi, "Kuti tameki salawa." This is not one of the things you want to test it because you get it, you may not never come back from it. And so people in Malawi, I know it's something that is hard to deal with, especially with the lives we live, but we are sending out a message for people to really be careful, to really do.
Totally.
So we still have the GoFundMe page as well, up and running. I think everybody knows that we will be taking donations up until the 31st. So you still have time to go to the GoFundMe of MDN for healthcare workers in Malawi. There's I think that's the exact link title. Yeah, MDN for healthcare workers in Malawi, and that should take you to the GoFundMe at GoFundMe. And if you can also search at GoFundMe MDN, and it pops up immediately.
It'll pop up.
MDN PPEs for healthcare workers in
Malawi. Yeah.
Yes.
Hey guys, we're gonna try it one more time, okay?
Okay.
Try the gas machine head one more time.
And of course, Zale is PPE4Malawi at gmail.com. That's a Zale.
Yes.
And the Cash App is a $MDN Malawi PPE.
That's right. And I just also want to give a shout out to one of my friends, Banda in Kansas. She just texted me and said that she just donated $20. $20, that's 2 songs. So I'm calling Linda to play 2 songs. And
can you guys hear me now? Can you hear me?
Yes.
We can hear
the music one more time. Yeah. We're going to try the gas machine head one more time, okay? Can you hear it now? Can you hear the music?
It keeps coming in and out.
Yeah.
Yeah.
It's fading in and out. We'll probably have to do another show
where you're just playing music.
Where they're playing music. You owe the audience another show.
Ken.
You still cannot hear the music?
No. So Ken, can you hear me?
Yes.
Okay, so what we're thinking is that we might need to do literally one show, probably where you're just gonna play music. But thank you so much for trying. We don't really know what's going on because he's using the same equipment.
The same, yeah.
Yeah.
He's done this before. It's the same. It's the same thing that we did before. Yeah.
Last time he had an extended concert. When we did it last time.
Yeah,
so it went on for hours.
For hours, yeah. So.
That's right. But well, in wrapping up, I just again want to thank everybody for their time and for donating their talents. And again, this effort, all this would have not happened without the coming together of so many different organizations that make up the MDN, the Malawi Diaspora Network, Malawi Washington Foundation, Malawi Association in Washington, Malawi Community in the USA, MAWA, Malawi Seattle Association, Malawians in Texas organization, New England Malawi Association, and also the Embassy of the Republic of Malawi. And again, this campaign was organized by a lot of people, over 20 people. There was a whole organizing committee. But I also want to take this moment to do a special thank you to Miss Violet Skiva, and she is with the Embassy of Malawi. She is the one who kept us organized. She's the one who put together all the meetings and the minutes. You know, somebody has to track what other people are saying, because the people like Eddie, they might say something today and forget tomorrow. But going. Anyway, thank you so much, our Ambassador Edward Sawerengira. Thank you, Sitinga Kachipande, Dr. Sitinga Kachipande again. And thank you so much, Changa Kamwambe. Thank you, Marvin Kaulembe, Helen Limbanzimba, Felix Lindeire, Wes Longway, Ken Malomboza, Patricia Saka Kamkondo, Robert Mseteka in New York, Elisa Muntali, Mwiza Muntali, Edina Mingona, Hanok Norma, Edwin Joe, Agnes Nkata Blackwood, Jordan Price, and our very own Dr. Linda Semu. Thank you so much for all this. And any other last words apart from thanking our country, everybody? And again, from me, Christina Gamkosi in Washington State in Spokane, thank you so much.
And thank you, Christina, for all of this, for keeping us all together on time too, with all the glitches. Thank you very much.
I think Dr. Linda Semu is here as well. She had some closing remarks.
Yes. You're on mute. You're on mute, Doctor. You're on mute. I don't know if you can hear us.
Can you hear us, Dr. Semu?
Yes, I can hear you.
Oh, now you're good.
Okay. All right. So I just want to thank everybody, the organizing team. I mean, as chair, my job is so much easier because of the team I'm working with. I don't have to do everything because I trust the people that we're working with to do the work. So thank you all. You brought your talents, different talents, organizational, financial, production, communication, marketing, branding, you name it, we have it. And you know, to me, looking at the way the team has worked, it's indicative of the talent that Malawi has. But we need to use it properly. We need to harvest it and use it in areas that will actually bring the best that Malawi has. And I'm hoping that moving forward, we'll be able to do more projects for Malawi and collaborate with our colleagues on the ground. This is why even some people asked and were wondering, why do we need dual citizenship? And this is why we need dual citizenship, because then it means people are rooted in Malawi. Just because we are not in Malawi doesn't mean we are not part of Malawi. We are still rooted in Malawi. Our identity is rooted in Malawi, and we should. And we're glad that there's dual citizenship. Although we are aware there are things that need to be ironed out, but for now, we are glad that we came together and we worked on this fundraising campaign, as the hosts have mentioned. We don't know, maybe this is just phase one. We are closing phase one. We might actually go into phase two, depending on the need, because we are ready. And the only reason we are ready is because the entire community and actually it's the global community. During the day of the virtual concert, we even had people from Europe donating. So this is a this is a global community, and each and every one of us is interested in Malawi. We also have a few other organizations that would like to team up with the Malawi Diaspora Network, and we're working on the modalities. So most likely we are likely to hit new targets, and that's what should happen, because all the money, and I want to emphasize this, the organizing team on the US side, the Malawi Diaspora Network, none of the members has taken any money. We have used our own personal funds, our time to contribute and to make this work, but all the money is going directly to Malawi, and all the money is directed at the beneficiaries. Our interest is the beneficiaries, and for this particular campaign, our interests are the healthcare workers. And as I said before, and that it has been reiterated, please, please, please be gracious to healthcare workers. Treat them with grace, because they're doing much more than is called upon at this time. And we need them. They're the key foundation for the survival of Malawi and for the well-being of Malawi in as far as this pandemic is concerned, and generally in terms of general health for Malawi. So we want to thank you very much. It's indeed Mutu Modzi Sadenka, and we have shown what Malawians can do when there's a commonality of efforts and everybody puts everything together. So please, thank you, pat yourselves on the back. You have done a wonderful job, and continue to support whenever we put out a call for an activity. Please continue to come out, to show up and support, because this is about Malawi. It's not about any one particular person, but it's about everybody else. So yep, as you've seen it, you heard it, we're only $1,500 away from $20,000. So please, please, let's keep it going. Let's keep it going. Should we make it 1,400 and I donate 100 right away to get started?
That'd be great.
Do we have anybody who would want to match me on that? Or even half of that?
Was
whatever you want to. I mean, we can even have 5 people each donate $20 to match me. You know, I'm pledging 100 right now. 5 people, $20 each, match me right away. Even those watching.
Those watching, there's a challenge to all of us.
Sorry?
I think Eddie said he's doing 50.
Oh, Eddie's doing 50 already, so we only need $50 more. My daughter just texted me. She's matching me.
Oh, wow.
Sweet.
Actually, Chief, she just sent me $100 on Apple Pay.
Wonderful.
The first time she has donated. I mean, when I count what I donated before, and my son and my daughter-in-law, we have donated, my sister-in-law, we have donated over $700 to the campaign.
Sweet.
Thank you.
Incredible.
Wow, it's fantastic.
So, yeah, so please, we're looking for matchers, even friends. Hey, Facebook friends, come on now. I know, right? You're watching.
We also have that bottle of gin. I think it's $500.
Yeah. There is $125 pledge from Facebook.
Oh, there we go.
There's $125. Yeah.
Yeah. There we go.
I'm definitely getting my gin.
Okay.
He has a lot. You pay yours.
No, actually, I'm getting Eddie's unless he matches what I've put up. So
he did.
He did. He put $50.
Yes, perfect.
I had done the 100 before for the bottle.
Yeah. So, are we trying? Is Ken trying to go on again? Is he gonna?
I mean, I would love to go on. Thank you, Dr. Semu, for your generous contribution. Thank you to your family. Thank you to everybody's family. I know there's a lot of people too, families that have come through. But let everybody mix their coffee and their lunch today. I need to be on a diet, so I'll mix my lunch. I put in 25. then I can put in another. I don't know. I have to ask my kids. Yeah, I'll ask them to put $10 each. So yeah, I think I'm beating there. You can't do I'm beating. But let me try one more time. I don't know if you guys can hear this. If you can hear this, put your fingers up.
No.
No fingers went up.
No, still no music.
No
We'll
music.
leave it alone.
Yeah, next time.
We'll leave it alone.
It's a demand. We have Kamanga from AD Kamanga has also put in $25 on Facebook. He knows He knows Eddie.
Oh wow! There you go.
Adaka Manga. You know?
Oh yes.
Yeah. Okay.
Oh yes.
And Elisa, our own Elisa Montali.
See? That's my friends coming through.
Oh wow. Okay. So that's
Elisa,
so we're coming up.
Friends, come through. Come through, friends. I have Banda from Kansas. Thank you so much for bailing me out.
And then early on in the day, we had an anonymous pledge on GoFundMe just before we got on of $100 earlier on. That was earlier in the day.
Oh, sweet.
Wow.
Yeah.
Wow.
Yeah.
Thank you so much, friends.
Thank you, friends. Thank you.
And Dr. Sitinga Kachipande as well is donating $25. We are getting close. Bring it on. Where's Tanga today?
She's missing in action. I haven't. Yeah. Haven't seen her for the last few weeks.
Also, I just want to thank Ntaka and Florence. They donated, I think yesterday, so on GoFundMe.
Ah, beautiful. Yes.
So I just want to say thank them for that.
And you know another name that I'm always seeing from you is Suzio Muntali. I think every week she sends something.
Wow.
Yeah. Every week I see something from her.
Wow.
Yeah, you're right about that, Eddie. Yes.
Yeah.
Yes, it's been amazing.
And
just quietly goes boom,
$10 for each family member. Aha, there you go. That's another $50.
By the time we're done, we broke, so we should end this.
I mean, and the thing is, actually, what I'm liking about this is the fact that the people that are organizing this, we're not just talking. It's not just talk, but we're actually committed to this. And
sorry to interrupt. Felix Lindieri has just pledged $100 on Facebook.
Right.
On Felix Lindieri.
Yes.
Thank you so much,
exactly. Beautiful. I mean, it's not just talk, but we put our money where our mouth is. So we are committed to this, and please, it's not like this is not about show off, but it's about encouraging everybody, because everybody, when we donate, we're making a sacrifice. As Kane said, some people have to forgo lunch in order to donate. So we appreciate. That's why we had to do the due diligence to make sure that we are working with partners that are credible, where accountability system is put in place. So we actually are very thankful. So, and to everybody, including our host today, we thank you. You have done a wonderful job. Despite the glitches, you guys have done a wonderful job, and you have made it a beautiful experience, and you make it look seamless, but there's a lot of work. Mervyn, we can't even thank you enough, and everybody else, we can't even begin to mention each and every name, but all of you, family members, community members, friends, colleagues, even some people donated because they just heard about it. They don't know us personally, but because they're committed to the mission. So we want to thank all of you, and we thank you for trusting us to do the right thing. And we're hoping that we'll go forward with more energy, more excitement to do more things for Malawi and to work with Malawi. And remember, we are working in partnership. We are not donors who just come and say, this is what you should do. We work in partnership to understand what is needed and to do what needs to be done. So we thank you all for your contributions, and we're looking forward to more collaboration and more support for Malawi. We can do it, and Malawi will rise. Malawi will rise, and we will be part of that history. So thank you all for allowing us to be your representatives and for trusting us to do the right thing. Thank you.
Thank you, Dr. Semu.
Thank you,
Thank you.
Dr. Semu.
Thank you for all the leadership and the work that you're doing. Yeah. I think we're wrapping up now. Ken, do
Yes.
you have a song to
Yes.
take us out? At least try to take us out.
For the
We can't even hear you now.
And then it's Eddie that put me on. I wasn't supposed to be hosting today. I'm just a guest. I'm not a guest. I'm not hosting. I'm just a guest.
Run away.
Yeah, I lost my COVID beard. Yeah, it's gone.
Your COVID beard, man.
It's gone.
I think that's another $10, Muiza. You can't lose your
Oh
COVID.
man, okay. I'll put it in the GoFundMe later on.
You're supposed to keep it throughout the campaign.
That's
And, well, it's really been an honor hosting everybody here today. And thank you so much. We'll let you go ahead and continue with your Saturday. And again, thank you so much. And again, my name is Christina Kamkosi, and I'll let my rest of the hosts and presenters say their goodbyes. But thank you. And Murumo Susan Zadenga, Zikomo Kwambiri.
Thank you.
Thank you very much. It's been an honor. And take care of yourself. Please take care of yourself and those around you. Thank you very much.
Thank you very much, I'm Mwiza Muntali. And thanks for all the support, the donations, all the hard work that you put in.
Ken, we can't hear you.
All right. Thank you very much. I can't say it enough, but I just want to say thank you. Thank you. Thank you. Thank you. Continue doing what you have started, and a day at a time, Malawi will rise and we'll do this, and we can get through this. And once again, take care of yourself, take care of others. An act of love is actually social distancing. We know it's unusual for our Malawi community, but we are doing it. And we just got note that there's Monastery has also donated. So let the donation keep coming. Let them keep coming because this work is not done. This is just the beginning. So thank you, everybody, and protect yourself, protect your loved ones. Let's not do. Let's do away with stigma, but instead be caring for others. Those that are suffering, those that have recovered. We're in this together. We are part of the community, local community, global community, and together we'll do it. Thank you very much. Thank you for all your time. Thank you for listening, for watching, and for all your support. Thank you for digging deep into your pockets. Thank you all.